Hi, CNS members. Today, I introduce our recent article titled Incidence and Characteristics of Cerebral Infarction After Microsurgical Clipping, which was analyzed using diffusion-weighted imaging. Post-clipping cerebral infarction is still a major concern, although DWI is a confirmative radiology tool for cerebral infarctions. Comprehensive studies are scarce for microsurgical clipping. However, to reduce the burden of PCI, a comprehensive understanding of diffusion-weighted imaging positive regions is crucial. The present study includes over 600 patients with anterior circulation unruptured intracranial aneurysms. The overall incidence of PCI is assessed as well for each aneurysm locations. The clinical and radiology characteristics are reviewed. PCI is categorized by 4 types. We defined type 1, surgical tract infarction, type 2, perianeurysmal perforated infarction, type 3, distal membrane infarction, and type 4, unrelated miscellaneous one. Here comes the result. PCI was diagnosed in 16% of the patient, comprising 1.8% of symptomatic one. Hypertension, temporary clipping apply, multiple location, larger aneurysm sites were the risk factors of PCI. At each aneurysm locations, the PCI rate and proportion of each type were not different. Type 2 PCI had the largest proportion, also it is closely related to postoperative neurologic deficit. Temporary clipping and atherosclerotic features were confirmed in over 60% of the patient. Possibly, manipulation or traction for circumferential dissection as well, permanent clipping result in PCI. The radiologic characteristics of DWI positive lesions after endovascular treatment are in line with type 3 PCI in the present study, oligodot lesions on white matter, which associate with atherosclerotic changes in the aneurysm wall and temporary clipping. The incidence of PCI is relatively lower than that of endovascular treatment. It supports that microsurgical clipping remains a valuable option for unruptured intracranial aneurysms considering DWI positive lesions. However, further efforts such as patient selection, modification of operative techniques, and preoperative identification of aneurysm wall characteristics are required to improve postoperative outcomes. Thank you.